All right, so here's the anatomy for advanced anatomy and physiology. We're looking at the pulmonary system. Now, when we look at the pulmonary or respiratory anatomy, we have the upper respiratory tract. The upper respiratory tract is the nasal passageways, the pharynx, and the larynx. Now, the pharynx is that dual structure, right? So it's part of the respiratory as well as digestive systems. Now, when we look at the lining of the upper respiratory tract, we see the pseudostratified ciliated columnar epithelium. We see that throughout the nasal passageways. We see that in the paranasal sinuses. We also see it in the trachea and the bronchi and the bronchioles. Now, this membrane is ciliated, and the cilia help to move the mucus towards the pharynx where we can swallow it and get rid of it. And within that membrane, we see the goblet cells producing the mucus. Now, the mucus is very, very, very important because it helps to warm the air, preventing irritations of the lower structures. It moistens the air, preventing your nose and your throat and your larynx and bronchi from drying out, allowing an opening for infection, and it allows for cleansing in the air. Okay, so the mucus is going to trap particulate, it's going to trap bacteria and viruses, and everything else that you breathe in. It's going to help to filter or protect you by trapping it, and then we can either blow it out or swallow it to get rid of it. Now, the structures here that we see, we have the opening of the respiratory tract, the nares, okay, or nostril, and then we have the vestibule. Okay, so the vestibule is this area right in here where we see the nasal hair. Again, the nasal hair is there to help filter air. Within the nasal passageways, we see the concha or turbinate. So we have the upper, middle, and lower turbinate. These structures here increase surface area for the mucus to, again, warm, moisten, and cleanse the air. Now, the paranasal sinuses that we see attaching here in a mid-sagittal section, we can actually see the frontal sinus or sphenoidal sinus. The other two sets, the ethmoid is just lateral to the upper nasal turbinate. And then the maxillary sinuses that are located in the maxillary bones or in the cheeks are just lateral to the middle and inferior turbinate. Okay? Now again, the sinuses, their job, produce mucus. The mucus comes down here and again helps to warm, moisten, and cleanse the air. Now, when we look at the nasopharynx, the area of the pharynx that connects to the nasal cavity, we see the pharyngeal tonsil of the adenoid. Again, it's a lymph node, which helps to initiate immune reactions. We can see the opening here of the eustachian tube. The palate separates the nasal cavity from the oral cavity. You have the hard palate, soft palate with the uvula. This seals off the nasal passageway to prevent food and liquid from going up into your nose. And in the oral pharynx that we see here, we see the palatine tonsil. All right, so the palatine tonsil, again, is a lymph node, helps initiate immune reactions to anything that's trying to get in through the portals of entry, right? Your eyes, your nose, and your mouth. Now, down here we can see the laryngopharynx, where the larynx is attaching. Now here we can see the epiglottis. Epi means covering, right? Or on top of. And so the epiglottis is on top of the glottis, or covers the glottis. Now the glottis is the opening of the larynx. So the epiglottis covers the glottis, the opening here, and this helps to direct food and liquid down into the esophagus, which lies posterior to the larynx and trachea. Now, the larynx is the final section of the upper respiratory tract. Inside, we can see the vocal cords. We have two sets. The top set here is the vestibular fold or false vocal cord. The bottom set is the vocal fold or true vocal cord. Now when you look at it, you can see there's a pearly white edge here to the vocal fold, and that denotes ligament. And that ligament is going to vibrate when air passes to create sound. Now when we look at the larynx from an anterior view, we can see some other structures here. We can see the hyoid bone, and this is where the larynx hangs. Then we see the two large pieces of cartilage here. We have the thyroid cartilage and the cricoid cartilage. Thyroid is more V-shaped. It has a tip called the prominence. The cricoid is circular, so it goes all the way around the bottom of the larynx. Between the two, we see a ligament here known as the cricothyroid ligament. So here's the cricothyroid ligament. Now, the reason that we want to point this out is if you ever needed to do an emergency tracheotomy, so if something was lodged inside the larynx and you could not get it out, and you needed to intubate the patient to get airflow started again, and you could not get past that obstruction, you would have to cut this area. Okay, you'd cut through the cricothyroid ligament to insert your tube to establish an airway again. Now, the trachea is the beginning of the lower respiratory tract. So we see the trachea start here at the cricoid cartilage, extend down into the mediastinum, just above the heart. It's going to bifurcate at the carina. Okay, so this point here is the carina. It's going to bifurcate into a right and left main stem or primary bronchus. The right primary bronchus is larger in diameter, primarily because the right lung is larger in size. Now, this does create issues. If you were to aspirate some food or liquid, the likelihood that it will go into the right lung is much higher than the left lung. And if it does go into the right lung, it goes straight down into the lower lobe, creating infection. And so it's very, very common to have a right lower lung infection due to this process where someone might aspirate. Goes right through that right primary bronchus down into the right lower lung. Now the left main stem or primary bronchus is longer, runs horizontally. This is because the heart sits 2/3 left of center, and it has to go around the heart to get to the left lung. Now, when we look at the bifurcations or the different branches here in the bronchial tree, again, main stem or primary bronchus, and then the next branch is the secondary bronchus, the next branch is tertiary bronchi. Okay, so all these colored segments are tertiary bronchi. Okay, so again, primary, secondary, tertiary. Okay, this is another secondary. These are all tertiary bronchi that we see. Now this goes on for around 8 divisions until we get to the bronchioles. Now when we look at the bronchioles do not have cartilage. Even though this model shows a little bit of cartilage left over, there should be no cartilage in the bronchioles. And these guys are going to have lots of smooth muscle. Now, the reason that bronchioles have smooth muscle is to allow them to adjust airflow through the lungs. Now, this is good for the most part when we look at sympathetic and parasympathetic action. Okay, sympathetic causes bronchial dilation, increasing airflow, increasing ventilation. Parasympathetic stimulation causes bronchial constriction, which limits airflow, limiting ventilation. Now, based on the two systems, it's easier to understand, right? When the sympathetic is there for activity, where the parasympathetic system is just there for resting. Now, on this model, we see 2 different bronchioles. We see this one right here. This is a terminal bronchiole. And then each branch from there is going to be a respiratory bronchiole. So one's over here, one's over here. These are respiratory bronchioles. Now, off of the respiratory bronchioles, we see these smaller ones here known as the alveolar ducts. So here's an alveolar duct. Okay, so here's an alveolar duct. Off of this would be a large alveolar sac. All right, so here you can see the alveolar sacs coming off of those little alveolar ducts. One of these, again, is an alveolus. These are grape-like to increase surface area for gas exchange. You have around 230 to 250 per lung. 230 to 250 million per lung. And you can see wrapping around the alveolus are capillaries. Okay, so all of these alveoli are going to be surrounded by pulmonary capillaries, and this is where external respiration takes place, gas exchange between the alveoli and the pulmonary capillaries. Now, the capillaries are fed by the arteries and veins. We have the pulmonary artery, which is blue, carrying deoxygenated blood to the capillaries, where it becomes oxygenated and then travels back through the pulmonary vein back to the left side of the heart. Now, when we look at the lungs, Okay, so we can see the apex, the conical point, which lies above the clavicle. And then we see the base of the lung, which sits right on top of the diaphragm. Now, the right lung has 3 lobes. It has a superior, middle, and inferior lobe separated by fissures. Across the front here, we can see the horizontal fissure separating the superior and middle, and then separating the middle and inferior is the oblique fissure. Now, for the left lung, we only have 2. We have a superior and inferior separated here by an oblique fissure. Now, the one unique structure that we see here on the left lung is the cardiac notch created by the heart, again, sitting 2/3 left of center. Now, here we see the diaphragm. Okay, so the diaphragm going all the way across, separating the thoracic and abdominal cavities, the primary muscle here of inspiration. Now, where the arteries and veins attach to the lung, okay, so here we can see the pulmonary arteries, pulmonary veins, where they attach to the lung, this area is known as the hilus or the hilum. Okay, so the pulmonary hilus or the hilum of the lung. All right, now, some other structures that we want to pay attention to will be the pleura. Okay, so the pleural membrane is what surrounds each lung. All right, so this white kind of lining that we see here, this is going to be the parietal pleura. This lines the inside of the rib cage. It also goes here across the diaphragm. The visceral pleura is just the shiny surface that we see of the lung. Okay, so this external layer is the visceral pleura. Now, between the two we see pleural fluid, which reduces friction, but it also creates a negative pressure. Okay, so the pleural fluid has a very high surface tension, and so it creates a negative pressure, which keeps the lung stuck or adhered to the rib cage. It also keeps it stuck or adhered to the diaphragm. This is extremely important because when we inhale, the diaphragm is going to contract, move inferior, and it's going to pull the lung with it. And as it pulls the lung with it, it creates a lower air pressure inside the lung, which then allows air to flow in until that space is filled. Okay, so again, according to Boyle's law, increasing the volume of the lung helps to decrease the pressure temporarily, allowing air to flow in. Without that negative pressure, okay, that lung would not go with the diaphragm, it would not go with the rib cage, and we would not be able to inhale. Okay? Now, if something were to get into this area, such as air, or maybe extra fluid, blood, a tumor, and it would cause these two layers to separate, the lung would collapse, and we would refer to that as an atelectasis. Okay, so an atelectasis is a collapsed lung. Most common is air getting in here. We call that a pneumothorax. Okay. All right. Now, some other little muscles that we see that help or assist with respiration are these muscles in between the ribs here. We call these the intercostals. Now, there's 2 types, external and internal. External intercostals help us with inhalation. Internal intercostals help us with exhalation. As long as you can remember that these assist with ventilation, you guys are good. All right. That should be it for the respiratory system for advanced anatomy.